afternoon, everybody. Thanks very much for giving up your lunchtime for this. I hope it's going to be of value to you. I have to say, for myself, in terms of the application of breathing exercises, it makes life a lot softer. And, very often we go through life, as I was, and I was one of those individuals who would overthink about everything. And even going through the Irish education system and coming out with a degree, I still didn't have the capacity to be able to direct my attention to where I wanted to direct it upon. I lived in my head a lot. And, I feel that it's a very good tool and an important tool to be able to step aside of thought and to be able to bring attention into the body and onto the breath, and to create a space between thinking, and then when you do need to think, you've got a better quality decision making as a result of it. Now, there's a number of things that tie in with this. When people talk about breathing, they think about mindfulness, or when they think about breathing, they think, take a deep breath. Well, take a deep breath could be actually the worst instruction that ever you follow. And the reason being is because very often it's interpreted that taking a deep breath means taking a big breath. If you take a big breath, it does not increase blood flow and oxygen to the brain. It does the opposite. If you take many big breaths, you're likely to get lightheaded or dizzy. So there is a way to breathe to help to bring a quietness to the mind, aside from just focusing on your breathing. So for me, mindfulness, I think we need to go beyond mindfulness. And there's nothing as well, the point that I would like to make about this, there's nothing left of field about this. Sometimes breathing is put in this category that it's not scientific, that it's woo-woo, it's over here. Having the tools to be able to direct your attention and hold your attention and concentrate and improve your energy levels and recover, there's nothing left of field about that. I don't consider myself left of field in any shape or form. And the science now, in terms of the last 30 years, is really catching up in terms of heart rate variability and bringing balance to the autonomic nervous system. I think just as human beings, we do have a tendency to overthink, and we have a tendency also to think negatively. And we're hardwired that way, probably because of survival. And something so simple as overthinking, you would ask then, well, how do I stop overthinking? Well, the answer is stop thinking. How do I stop thinking? Well, you bring your attention onto your breath, into the body, into the present moment. Now, of course, thoughts arise, but a thought isn't thinking. As I'm talking here, I don't want to be immersed in thinking, because if I am immersed in thinking, the words simply are not going to come out. And the other thing is that if I put too much emphasis on the fact that I'm speaking to a group of individuals, maybe it would scare the life out of me. My heart rate starts increasing, then I go into a fight or flight response, and while my body might be in the room, my brain is telling me to get out of the situation. So in a nutshell, what I would like to do is talk about helping to bring balance to the autonomic nervous system. Very simple stuff that I use myself, how to improve sleep quality, and also then bringing attention out of the mind and onto the breath and into the body. And life just is that bit softer, because so many of us, we do go through life literally lost in thought, immersed in thought, or drowning in thought, or lost in rumination. And thinking is addictive. And what's, I suppose, the definition of an addiction? We cannot stop it. Can you stop thinking? That would be one question that I would put to you. And the second question that I would put to you is, have you been trained how to concentrate? And in order to concentrate, to be able to direct all of your attention on one thing, you need to get the critical mind out of the way. But if the body and mind, if the autonomic nervous system is in an increased stress response, well, the mind is naturally agitated with increased thought activity. So where's the first step? For me, the first step is breathing in and out through the nose. So simple. Our nose has 30 functions minimum in the human body. Breathing through the nose during rest, breathing through the nose during sleep, and breathing through the nose during physical exercise. It's known since 1988 that when you breathe through your nose, that your oxygen transfer, PaO2, the partial pressure of oxygen in the arterial blood, increases by nearly 10%. It's also known that nasal breathing has better recruitment of the diaphragm. And of course, we want to be breathing nose, to be breathing slow, and to be breathing low. What I would like you to do is to take a breath through your mouth. and look down at your chest. So if you look down at your chest and take a breath through your mouth. So as you breathe through your mouth, what part of your body is moving? Are you breathing high or are you breathing low? High. And also as you breathe through your mouth, is your breathing faster or is your breathing slower? It's faster. So if we mouth breathe, then we naturally activate a fight or flight response because we have faster breathing, we have harder breathing, and we have upper chest breathing. And this way our body is telling the brain that the body is not safe. And all the brain cares about is survival. So if the brain feels that the body is under threat, well, the brain is going to launch us into a fight or flight response. So the first step for everybody is the importance of breathing in and out through the nose. Now, this literally gets no attention whatsoever. I've been talking about it for 22 years. It did change my life when I came across it about 25 years ago. And predominantly, I was a mouth breather, having asthma. You also have a stuffy nose because if you have asthma, which is inflammation of the lungs, it will travel up to your nose. So any of you here with asthma, you're probably more likely to have a stuffy nose. And if you have a stuffy nose, your sleep is impacted. But it's not just your sleep is impacted. Your cognitive function is also impacted. Your ability to plan, your ability to reason, to make decisions, that's all impacted by how we breathe. So if our objective is to be able to stay calm under pressure, or at least take things in our stride to self-regulate, nose breathing is important. I'm going to start you off with a very simple exercise to lead you into an exercise how to decongest your nose. And the wonderful thing about the human nose is that the more you breathe through it, the better it does work for you. And it is about breathing through the nose during rest, during exercise and during sleep, and even during physical exercise. You know, of course, you might say, well, if I'm sprinting, I can't breathe through my nose. Well, that's true. But how about this? How about if you did your physical exercise with your mouth closed, and then your body adapts to that? So then you can do physical exercise with less ventilation. So our body adapts to it once we do it. And the thing about nose breathing is that it does target the diaphragm. The diaphragm breathing muscle is connected with the emotions. And our diaphragm breathing muscle is also connected with our sleep, because the diaphragm is mechanically linked with the upper airway dilator muscles in the throat, which are responsible for helping to maintain an open airway during sleep, which then in turn would reduce the risk of obstructive sleep apnea. And the reason that I talk about sleep and breathing and the mind, you cannot separate them. If your sleep is off, your mind is off. Any of you who wake up with a dry mouth in the morning, you're not likely to wake up feeling refreshed. And already, you're not on a good start. And when you look at people with mental health issues, they don't just have rumination of the mind, they are tired. And they are tired possibly because of a sleep disorder breathing. It could be snoring, it could be insomnia, or it could be obstructive sleep apnea. But then the question to ask is, well, this person who is anxious, or who is having panic disorder, or who is feeling depressed, if their anxiety and panic disorder and depression is just targeted from a mental health point of view, but if they have an underlying sleep disorder which is not being treated, are you going to get a successful outcome? So we can't separate the mind from the breath from sleep. They're all interconnected. So let's start off with a very simple exercise. My quest for today is just to kind of give you simple tools that I use myself. I found them very beneficial. I've worked with thousands of individuals, so I've seen kind of the impact that they can have. They can be very helpful. So whenever you're ready, this is just a lead into the nose and blocking exercise. So take a normal breath in through your nose and out through your nose. We shouldn't really hear it, by the way. So it's just a normal breath in through your nose and a normal breath out through your nose, and pinch your nose and hold your nose and hold your breath for 5, 4, 3, 2, 1. Let go. Breathe in through your nose and breathe normally for about 10 to 15 seconds. What does holding the breath after an exhalation do? It triggers relaxation. It stimulates the vagus nerve. And it's a very short breath hold. So if you're really, really stressed, it's not easy to be mindful. It's not easy to pay attention to your breathing. Hold your breath, but hold it for a gentle, short period of time, yeah? Take a normal breath in through your nose, out through your nose, and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and just breathe normally for about 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold. 5, 4, 3, 2, 1. Let go, breathe in through your nose and breathe normally for 10 to 15 seconds. So this would be an exercise that we would use a lot with people with panic disorder or anxiety, that they have a lot of overthinking going on. And the other thing about doing a simple breath hold after exhalation, it can help improve blood flow to the brain. You don't increase blood flow to the brain by taking full deep breaths. The full deep breath that's in yoga only came about in 1880. Breathing in yoga up until 1880 was the opposite of full deep breaths. It was about conservation of the breath. It's not a good sign when you notice somebody breathing a lot of air. It's not a good sign. Take a normal breath in through your nose and out through your nose and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, breathe in through your nose and now breathe normally for 10 to 15 seconds. So when the mind is agitated, hold your breath. It's a lot easier to do than trying to be mindful or trying to think positive. Positive thinking doesn't work when you're in the throes of emotional discomfort. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and breathe normally for about 10 to 15 seconds. So I'll do this for about 30 seconds more, and this is kind of your warm-up into the exercise to help open up your nose. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, breathe in through your nose and just breathe normally for 10 to 15 seconds. So just breathe normally. You shouldn't really feel air hunger or anything like that, but if it's too uncomfortable for you, hold your breath for a little bit less. And the other thing about people, say if you are prone to panic disorder or hyperventilation, very often you can become accustomed to having a very strong fear reaction to air hunger. So whenever you experience air hunger in your everyday life, it can generate this fear response. But what we are doing here is giving you a teaspoon of air hunger to help desensitize your reaction to the fear of suffocation. And I think it's a very important intervention for people who do have, that fear of suffocation, because you have to bear in mind, breathing is a very personal thing. And whenever we have trauma or high stress or panic disorder or hyperventilation or asthma, COPD, other different conditions, how do we feel? Well, number one is our breathing is impacted, but number two, we feel suffocated. So the body then is conditioned to associate suffocation with fear. But here I'm giving you a tiny dose of suffocation in a very safe environment, and that will help to desensitize the body's reaction to it. So that when you do feel suffocation, this is helping to desensitize your fear of air hunger, which is important, yeah? Take a normal breath in through your nose and out through your nose and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, breathe in through your nose and breathe normal then for 10 to 15 seconds. So now the nose and blocking exercise. If you're pregnant, don't do it. That's the only thing. So congratulations, but don't do the next exercise. If you do have panic disorder or anxiety, you have to go easy enough, because you don't want to give yourself too strong a dose of air hunger that could tip you into a panic attack. And I don't know your backgrounds. So we'll kind of gently do it anyway. Nothing extreme, yeah? It can be helpful if ever you want to get a sense of how open or closed your nose is. Simply it's based on a fogging test, and you just put your mobile phone underneath your nose like this, so breathe onto it and then look at the halo. And you will typically see that one side of your nose is a bit congested and the other is more open. This is normal. It's the nasal cycle. They switch every 90 minutes or so in a good functioning nose, not in a nose like mine that has a deviated septum. So if you have a deviated septum, which is relatively common, you don't have the same nasal cycle. But anyway, let's see if we can decongest the nose. Take a normal breath in through your nose and out through your nose, and pinch your nose and hold, and nod your head up and down, holding your breath for 10 head nods. I know it looks a bit strange. So you're breathing in, breathing out, and holding for 10 head nods. And then you breathe through your nose. When you hold your breath, it's known since 1923 that the blood vessels in the nose, which have swollen, which is contributing to the nasal congestion, they shrink. And it's thought that it's due to the breath hold causing an increase of carbon dioxide, which causes a stress response, which in turn causes the nose to decongest. We did a pilot study on this back in 2013 with Limerick Regional Hospital, and in the sinonasal outcome test and in the nose questionnaire, and also on the visual analog scale, it showed reduction of symptoms, nasal symptoms, of 70% at 3 months follow-up. Just by simple breathing exercise and breathing through your nose. Your nose is a wonderful organ. But I remember I've always had trouble with my nose, and that's what got me into breathing, because you don't just have a problem with your nose. I had a nasal operation in 1994. I think turbinates were removed, the septum was corrected. Nobody told me to breathe through my nose afterwards. So it was a failure. It's only a failure if you actually breathe through the nose. It's not enough to treat the nose. And there's very few ENT departments which not only are fixing the nose, but changing the behavior of mouth breathing afterwards. You can't just remove adenoidectomy, or you can't just remove the tonsils and adenoids from a child and expect that child to breathe through the nose afterwards. They need to have respiratory rehabilitation, otherwise it's a short-term outcome. Can we go again? Take a normal breath in through your nose and out through your nose. Shouldn't really hear anybody breathe. Hold your breath. Just gently nod your head up and down, holding your nose, and hold your nose for about 10 to 15 head nods. So 10 to 15 head nods. And do it to the point that you feel it's a challenge, but at the same time you should be able to recover breathing in and out through the nose afterwards. And even with a head cold, this exercise will help. It helped me with COVID, and it's helped many people. I put a video up on this in March 2020. Just at the start of COVID, and it had over 1 million views. So quite a few people who had COVID actually ended up doing these techniques. And there is a paper now looking at long COVID and dysfunctional breathing patterns. Because of course long COVID is associated with dysregulation of the autonomic nervous system. And the beauty about the breath is that the breath is a way of intervening or directing the autonomic nervous system. Can we go again? You feel comfortable? Take a normal breath in through your nose, out through your nose, pinch your nose, hold your nose, and just gently nod your head up and down. I think that lady breathed in and held her breath, but I'm not sure. So keep holding your breath, keep nodding, just keep holding your breath, and continue holding your breath until you feel it's quite challenging. And at the end to let go, but breathe in through your nose, but you should be able to recover within 2 breaths. So to open up your nose, hold your breath for a minimum of 20 seconds and hold it on an exhalation. And then of course, the more you breathe through your nose, the better your nose works. I don't have a figure for the amount of people with rhinitis. I think it's about 30%. You might have a more accurate figure than that. But even in a room like this, there's probably 30 of you, likely, that have a stuffy nose and your sleep is impacted as a result. Once more, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose. And I think this lady breathed in and held your breath. Always breathe out and hold your breath. So always breathe out and then hold your breath. And keep on holding the breath. Keep holding the breath. Keep relaxing into the body. I know it's a bit uncomfortable. Keep going, keep pushing, keep going, keep pushing. And then to let go and breathe in through your nose. Now, normally as well with this can help to shift mucus from the lungs. So you notice people are coughing or some are shifting mucus. It's normal. So say, for example, as you hold your breath, nitric oxide is pooling inside your nasal airway. Then when you let go of your nose, you breathe in through your nose, you're carrying this nitric oxide into the lungs. But also as you do a breath hold, carbon dioxide is increasing in your lungs, increasing in the blood, and this helps as a bronchodilator. This was written back in 2002 and before. By 2002, there is a paper in the New England Journal of Medicine called Hypocapnia, which is written by Laffey and Kavanagh, looking at the connection of fast and hard breathing and how it's feeding into asthma, for example. So you could say that people with asthma breathe hard and fast because of their condition. That would be normal. If your airways are tight, you feel you're not getting enough air, you will have your mouth open more likely, you will breathe faster and harder. So is it asthma which is causing faster and harder breathing? Or is it the faster and harder breathing, which may be through the mouth because of the sensation of air hunger, which is feeding back into airway narrowing? There is a vicious circle in asthma. And even with people with asthma, it's very important, breathe through your nose. Your nose warms the air, it moistens the air, it regulates volume. You harness nasal nitric oxide, you take the air into the lower regions of your lungs. Your mouth does nothing for breathing. What is in your mouth? Your teeth, your gums, your tongue, your hard palate, your soft palate. None of those things do anything for the breath. Nature did not design the mouth to breathe. If nature designed the mouth to breathe, there would be something in the mouth for breathing. There's not. The mouth is for eating, for drinking, for speaking, for kissing. That's the functions of the mouth. Can we go once more? Take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and just gently nod your head up and down, holding your breath. And relax into the breath hold. So you're just gently relaxing into the breath hold. It is a bit uncomfortable, but even surrender to the sensation of discomfort. So you're surrendering to the fact that it's a bit uncomfortable. Okay. I'm just curious, even in a group, and you don't have to put up your hands just to make me feel good, but I'm just curious to see how many of you are feeling that there's a change happening in your nose. Can I just see a show of hands? How many of you feel there's a change happening in your nose? Yeah? Nothing is ever 100%. And you don't all have nasal congestion. So, but I would really encourage you, anytime you have a stuffy nose, do that little breath hold. Yeah. That was the first exercise that got me into breathing because it worked. I always had a stuffy nose. And the second exercise that got me into breathing was actually breathing less air. I'll give you a story. I went to TCD down the road. I was pretty anxious as a teenager. I lived a lot in my head. I didn't have anxiety, didn't have panic disorder, touch wood, but I didn't have good concentration and I had a racing mind. And I did my Leaving Cert in Sink Street, and I would walk to Sink Street from the bus, but I wouldn't see any of the streets because I would walk those streets living in my head. And going into, I got my points for the Leaving Cert, got into TCD, 1996-97 was my finals, a bit anxious going in. I said, okay, before I go into the exam hall, I want to calm down. What did I do? I took 1 or 2 minute walk before going into the exam hall, and I took these full big breaths because that's what I had read, that it was beneficial. Take a deep breath. Did you ever hear that instruction? Take a deep breath. Will you show me what a deep breath is? Show me a deep breath. That's what I did. So for 2 minutes, I walked taking deep breaths. And I remember walking into the exam hall and I was totally disoriented. Why? I was already stressed. How do you breathe when we're stressed? How would you breathe? You breathe faster, you breathe harder, you breathe upper chest, you take fuller breaths. So I was already stressed, and then I took a walk and I took even more breaths. And I reduced blood flow and oxygen delivery to my head, into my brain, and as a result I was disoriented. It was the wrong thing to do. Absolutely, 100%. And it took a while because I already had dysfunctional breathing for everything to go back towards normal. So I would say it was 5-10 minutes anyway of feeling disoriented. I came across this exercise then a few years later and I practiced it. I always had cold hands and cold feet. You don't just have cold hands and cold feet. It's very common also to have brain fog. I never realized that my blood circulation was impacted directly by how I breathed. By having my mouth open, by breathing faster and breathing harder, it was reducing my blood circulation and oxygen delivery. So let's practice this exercise and we'll see, can it help to improve your blood flow, but also can it induce relaxation? How would you know if you're going into relaxation? How would you know if you activate the rest and digest response? If you activate the rest response, how do you feel? Sleepy? Sleepy, would it be? Yeah. If you activate the digest response, what happens to saliva in the mouth? Increased watery saliva. So let's see that. Can we activate rest and digest? Don't worry, I'll take you out of it too. So rest and digest. Now, if when you're practicing the exercises it makes you a bit too uncomfortable, it could put you into a fight or flight. Your mouth goes dry, your heart rate speeds up. I don't want to do that, okay? But I don't know how you're going to react, but you know what, let's give it a go. I would like you to have one hand on your chest and one hand just above your navel. And I would like you to bring your attention out of your mind and onto your breath. This is about doing the opposite to over-breathing. This is about breathing less air. This is about under-breathing, and under-breathing to something similar if you went for a fast walk. So when you're going for a fast walk, you're going to feel slightly breathless. And there's no different than what we're going to do now in terms of the sensation of breathlessness. You have your attention out of your mind and on your breath, and I would like you to feel the slightly colder air coming into your nose and the slightly warmer air as it's leaving your nose. And as you bring your attention from your mind onto your breathing, I would like you to soften the speed of the air as it's coming into your nose, almost as if the breath in is imperceptible. So I shouldn't see much movement. I need you to hide your breathing from me. I shouldn't see a whole lot of movement. And I have 20/20 vision. So take a very, very soft breath in through your nose and a really relaxed and a slow and a gentle breath out. I would like you to reduce the air that you're taking into your body by about 20 to 30%. And as you're breathing out, I would like you to bring a feeling of relaxation to the body, that you have a relaxed and a slow and a gentle breath out. You're doing it correctly if you feel that you're not getting enough air. You're doing it correctly if you feel a sensation of breathlessness, a similar sensation as if you were going for a walk. Now, what does the sensation of air hunger indicate? It just indicates that there is a slight increase of the gas carbon dioxide in your lungs and blood. So let's continue with this. I would like you to take a very, very soft, gentle breath in through your nose and a really relaxed and a slow and a gentle breath out. There are many of you here in this room. Leave some air for your comrades, for your work colleagues. Don't be too greedy with your breathing. So I would like you to breathe less air so that you're leaving some air for everybody else. You're taking a soft breath in through your nose and a really relaxed and a slow and a gentle breath out. And the whole purpose is that you're feeling that you're not getting enough air. Now, if the air hunger is a little bit too uncomfortable for you, just breathe a little bit more. But let's do this as an experiment. What happens when a group of people breathes less air? Can we directly influence our blood circulation? Can we influence the blood, or so the saliva in the mouth? And can we influence our state of mind? So ironically, you are feeling that you're not getting enough air, but this does not indicate that there's reduced oxygen delivery throughout the body. In actual fact, the opposite is taking place. And even as you're feeling a need for air, which signifies that carbon dioxide is increased in the blood and blood pH has dropped a little bit, your red blood cells now are releasing oxygen more readily throughout the body. So you're taking a very soft and slow, gentle breath in and a really relaxed and a slow and a gentle breath out. Take a rest. Take a rest at that. I'm just curious, how many of you felt a sensation of air hunger? Can I just see a show of hands? Okay, so that's what we're looking for. Does anybody notice? So it was quite a few of you, which is great. It's a little bit uncomfortable, and this is also part of the reason that we use this with people with anxiety and panic disorder. Again, it's a controlled dose of discomfort. You know, air hunger is a primal fear. We as human beings, we have fear for lack of food, fear for lack of water, but the biggest one is a fear for lack of air. And you have air hunger any time you kind of ramp it up during physical exercise. It's just there's something different when you do it sitting down. But think about what's happening. This is what I would do whenever I want to down-regulate. I sit down in a comfortable place. I shift my attention from the front part of the head towards the back of the head, onto my breathing, into my body. I take a soft breath in through my nose and a really relaxed and slow, gentle breath out. Because that's the opposite to how we breathe when we're stressed. I was listening to a podcast by Dr. Rangan Chatterjee. Some of you will know of him. He's a UK GP. And he was interviewing a brain surgeon, Dr. Ahood. And Dr. Ahood said, can you imagine being a brain surgeon? And Dr. Ahood said, when I get into a tricky situation, this is what the doctor said, when I get into a tricky situation, the first thing I do is prevent myself from hyperventilating. When I get into a tricky situation, the first thing I do is prevent myself from hyperventilating. What is hyperventilation? It just means that your breathing is a bit faster and a bit harder to cause an increase in the volume of air that you are breathing. It's not that you're having a panic attack. It's not that you're having a hyperventilation attack. It just means your breathing got a bit faster and harder. It's relative. But what would that hyperventilation do? It will tell your brain that there is a threat. And your brain then is going to, the body and mind is going to go into a fight or flight. So what does he do? When he gets into a tricky situation, the first thing he does is prevents himself from hyperventilating. How do you prevent yourself from hyperventilating? Bring your attention into the body, onto the breath, take a soft breath in through your nose and a really relaxed and slow, gentle breath out. And then you are telling the brain that you are safe. That's all your brain wants. And your brain then will send signals of calm to the body. You can bring down your heart rate. It's really, really good practice. Don't wait until the tricky situation. Bring it into your way of life. Bring it into your way of life. Can we go again with that exercise? So one hand on your chest, one hand just above your navel, taking your attention out of your head and into your body, onto your breathing. And I would like you to pay attention to the slightly colder air as it comes into your nose. And by the way, don't worry about doing this perfect. Don't care what happens. Just kind of, this isn't an exercise that you get perfect because there's a small conflict, air hunger, which is a bit of a stress, with relaxation. So there's kind of, we're teetering on the brink of relaxation stress at the same time. That's why it's interesting. So you're bringing your attention into the body. Take a soft breath in through your nose and a really relaxed and a slow and a gentle breath out. And I would like you to tell your brain that you are safe. How do you tell your brain that you're safe? Soft breath in, almost that your breath in is imperceptible. And a really relaxed and a slow and a gentle breath out. Now we're going one step further here in that we're softening the breath to the point that you feel air hunger. You could close your eyes if you feel comfortable. Sometimes it's nice to close the eyes to bring your attention inwards. So you're bringing your attention inwards and onto your breath. I would like you to pay attention to the slightly colder air coming into your nose and the slightly warmer air as it's leaving your nose. And as you're breathing in, you could also do it, instead of taking 100% of the breath in, take in about 70% of the breath in. So it's a softer breath in through your nose, and it's a really relaxed and a slow and a gentle breath out. And don't worry about doing it perfect. And also, you might notice there's a tendency, there's a tendency for your mind to wander. And every time your mind wanders, to bring your attention back onto your breathing. In actual fact, it can be a good insight to seeing just how often the mind wanders. And the mind does wander, of course the mind wanders, but bringing your attention back onto the breath. And it also helps to bring a little bit of a holiday for the mind, getting it out of our heads. So you're taking a very, very soft and slow, gentle breath in through your nose, and a really relaxed and a slow and a gentle breath out. So as you sit there, minimize the volume of air that you are breathing. How do you do that? You could make the breath in a little bit shorter. So instead of taking in 100% of your normal breath in, breathe in 70%, or you could really slow down the speed of the breath in. But the key also is that the breath out is slow and relaxed, because it's by having a slow and relaxed and a gentle breath out that we are telling the brain that we are safe. We stimulate the vagus nerve. The vagus nerve secretes acetylcholine. Acetylcholine causes a slowing of the heart rate slows down, and the brain interprets that the body is safe. But your brain is spying on your breathing as well. So there is a structure in the brain that literally is spying on your breath. That's why we have to be careful. What do we tell the brain? And if I'm breathing that bit faster and harder and mouth breathing, I'm telling my brain that I'm stressed. And all the brain wants is survival. So how do we tell the brain that we are safe? Breathe soft, breathe nose, breathe light, breathe slow. So you're taking a soft breath in through your nose and a really relaxed and a slow and a gentle breath out. Okay, take a rest of that. It's quite simple exercise. That exercise is called breathe light. I haven't focused on the diaphragm. I only wanted to focus on one thing there, take less air into the body. I'm curious, how many of you notice if there's an increase? By the way, how many of you, your mouths went dry there? And I just see a show of hands. Some of you will. So a dry mouth can indicate that the air hunger just might have tipped you into a little bit of a stress response. Mouth goes dry. How many of you noticed that there was an increased watery saliva in the mouth? Can I just see a show of hands? Okay, it's more. How many of you had no change? Show of hands. Okay. So you can see in the group, typically we would be looking for increased watery saliva in the mouth. But when it's your first time doing this, it's never 100%. That doesn't mean it doesn't work. So what I would say is when you're at home, especially in the comfort of your own environment, just practicing, taking a soft breath in through your nose and a really relaxed and slow, gentle breath out. What do I use it for? I use it for public speaking. I don't want to go out on stage talking from the critical mind. I need to get my mind out of the way, because the critical mind, the mind often sabotages us. And a lot of the thoughts that go on in the mind are quite negative. So for me, whenever I'm doing a public talk, especially if it's a big one, I was in Ostrava there about 2 weeks ago. I had 500 people on one talk and about 400 in the other. My first talk was about breathing, and my second talk was about stop overthinking. So 500 people. And I talk freestyle, I don't use PowerPoints. I need to be able to tell my body and mind that I'm safe. That's all I do. So I usually spend about a half an hour beforehand. I sit down, I hide from everybody. I didn't do it today, I talked. But I normally hide, bring my attention inwards, and I conserve all of my attention for myself. And the reason being is because I want to give all of my attention to the task at hand. And I get tired if I talk to a lot of people. And I think that's kind of what an introvert, what happens. But also before I go out on stage, I bring my attention out of the mind and into the body. And I walk out on stage with every cell of my body, with my attention dispersed throughout the body. And then I'm fully in the moment with my attention moving simultaneously in time. Self-doubt is not going to arise so easily. Thoughts come into the mind, I talk those thoughts, but I don't get latched onto thinking. Because if I was to get latched onto thinking, it would probably scare the life out of me. So we do have to get the mind out of the way. We have to get out of our own way. And it's a very important, and really, I think it's a helpful tool to be able to get your mind out of the way, that you can be immersed fully in what you're doing. And fully immersed in what you're doing in the absence of thoughts, where you and the task at hand become one. Now that's called flow states. Can that be reproduced? Yes, it can. Why do I say that? Well, I can do it all the time. And of course, I'm not going to be any different than you. All I did was I brought this into my way of life. I don't do any formal meditation. I don't do anything like that. But what I try to do is, driving up from Galway today, I have my attention on the road, but I bring my attention into the body. I do 30 minutes of exercise a day, that's all, on a cross trainer, but I do it with every cell of my body. So at different times throughout the day, I want to bring my attention out of the mind and onto the breath. And this way then it becomes your way of life. I don't want to give you something else to have to do. You're already doing some physical exercise. You're probably already on the bus. You might be on the train. Whatever you do, you're out walking your dog. Do that with every cell of your body. Use it as a means of being able to hold your attention on one thing. Does it make sense? Now, what's the benefit of it? Well, it's there for when you need it. And also, how can we hold our attention on one thing to the exclusion of distraction if we are practicing distraction all day long? I have no apps on my phone for social media. Zero. No Facebook, no Instagram, no LinkedIn, no nothing. Get rid of them. And the only reason that I say it is because it's a distraction device. And those are specifically crafted to capture your attention. And I don't like the thought of Mark Zuckerberg making money on the back of my attention. So I don't want to give him my attention. I want my attention to bring it inwards, because this is a lovely place to be. Now, I don't want to sound too woo-woo. This is practical stuff. But our life is already, there's enough challenges in life, and there's so many things that take our attention. And how many times do we actually give ourselves attention? And when you're working with your clients or working with your patients, to be able to be with your patient in the absence of thought, to give all of your attention to what you are doing, because your patient will sense that stillness. It's a different story than when we work and we are fully consumed in thought. Can we go again? So one hand on chest, one hand just above navel. Now there's two ways that you could do this. You could do it without air hunger, and that also will tell your body that you're safe. So say, for example, I don't know if you give public, maybe you have a boardroom presentation, some of you, or any situation. You've got somebody who was not particularly nice. It could be a manager, it could be a work colleague, things happen. And instead of that consuming every waking moment that we become, that it washes over everything that we do, just to bring some space between the thought activity that's happening as a result of the situation that's after happening. In other words, how do we bring a sense of calm to the mind? Simply bring it onto the breath. And the same instruction. And the reason that I'm kind of doing this a few times is because I want you to remember it so that you have it then. It's simple, it's free, you have it for the rest of your life. That's it. You're taking a soft breath in through your nose, and a really relaxed and a slow and a gentle breath out. So when you're bringing attention into your nose, you might feel the slightly colder air as it comes into your nose. Bring your attention to that. Can you feel the slightly colder air as it comes into your nose? And as you feel the slightly colder air coming into your nose, soften and slow down the speed of the air as it enters your nose. And as you're breathing out, allow the air to leave the body effortlessly. Really relaxed and a slow and a gentle breath out. So it's a very, very soft, gentle breath in through your nose, and it's a relaxed and slow, gentle breath out. Doing it almost that you want to soften your breath to the point that you feel air hunger, but you don't want the air hunger to be too much that it causes you a little bit too much stress. So if you find that it becomes too uncomfortable for you, just take a rest. Okay, so it's a simple instruction. We said that we'd leave some time for questions and answers. The other thing that I would like to talk about is, just quickly, breathing through your nose during sleep. 50% of you here will wake up with a dry mouth in the morning. I know it sounds bizarre. I actually started taping my mouth back in 1998. And I know some of you, your heart rates are already up on hearing that. But for every time that I was waking up with a dry mouth in the morning, my sleep quality was not good. So there is a safe way to actually get the mouth closed. I just want to show you this, because I would talk more about a nasal breathing support, and this can be used if any of you are on CPAP machine, which in turn improves the efficacy of the CPAP. So having a cotton product that you stretch it surrounds the mouth, You stretch it about 30%, and it's the elastic tension which is pulling the lips together. Now that's a safe solution, and even with people with obstructive sleep apnea, it allows mouth puffing, so it's not going to increase the AHI as a result of having the mouth closed. I have written a scientific paper on sleep apnea and the application of breathing and functional breathing in and out through the nose in your everyday life and how it improves your sleep. But I'll kind of just leave it like that, and I'll open up the floor for questions. We do have an app called the Oxygen Advantage app, which is free. Everything inside it is free. So you can get access to different exercises and different protocols.